Well, that was unsettling. Are you feeling okay after that last sketch? We just endured the isolated and misunderstood first-generation antipsychotics, but it's time to jump ahead a generation. The second-generation antipsychotics mark an evolution in side effect profile as these drugs cause less of the classic neurologic side effects and instead a variety of metabolic effects. Although most of these drugs were developed in the 1990s, they certainly reflect a similar evolution in the art world taking place in the 1890s and beyond. Post-Impressionism soon gave way to Expressionism. Artists like Mack and Kirchner employed distorted imagery and a rich palette to convey profound emotion. Art now came from within the artist, and as it delved deeper into the human subconsciousness, art became more abstract. No sooner had Picasso painted his first of many cubist guitars, however, than Miro proclaimed his desire to assassinate painting, famously saying of the Cubists, "I will break their guitars." After the disillusionment of World War I, art was seized by the Surrealists. It was a revolution of the mind, a rejection of the bourgeoisie, a time when artists discarded reason, expressing instead the dreams and desires of the unconscious mind. Enter a young Salvador Dalí. The year is 1934, the setting, his first art exhibition in New York. His works immediately created a sensation as he drew on themes of myth, primitivism, sex, madness. Shh. Sorry. Yes, I can read. Okay, I think the exhibition is about to start, you guys. See that sign there? Or I think it's a sign. It could be some kind of Dadaist art, I guess. You never know with these things. Anyway, if you use your imagination, you might just see the names of a few of the atypical antipsychotics. Quiet for quetiapine, only for olanzapine, whispering for risperidone, and appropriate for aripiprazole, of course. And let's not forget ziprasidone, symbolized by the prominent zipper on the back of that chic black dress. Clozapine is the prototype atypical antipsychotic. And in this sketch, whenever we mention the side effects specific to clozapine, we'll direct your attention toward this surrealist wardrobe. Believe me, there is more than meets the eye in there. Think of it as the clozapine closet. Discovered in 1959, clozapine was deemed an atypical antipsychotic because it was associated with less extrapyramidal symptoms at doses equivalent to the previously developed typical antipsychotics. As a result, there was a major shift in clinical practice away from first-generation typical antipsychotics toward the use of an increasing number of second-generation atypical drugs. Like the first-generation antipsychotics, second-generation agents block postsynaptic D2 receptors in the central nervous system, especially in the mesolimbic and striatal frontal system. So, as Salvador Dalí reveals his latest masterpiece, he grabs onto and yanks down that D2 double dopamine rope. The mechanism of action of antipsychotics is not completely understood, though. Although all effective antipsychotic drugs block D2 receptors, the degree of this blockade in relation to actions at other non-dopamine receptors varies considerably among drugs. In fact, several of the second-generation antipsychotics have much less effect on D2 receptors. It turns out that 5-HT2A serotonin receptor blockade is a key factor in the mechanism of action of second-generation antipsychotics. And because serotonin is the hormone that makes you happy, we've brought back our recurring symbol, the serotonin smiley face. This time incorporated into a little smiley face cake set out for the exhibition after party. See that slice taken out of it? Think of blocking serotonin, though knowing the Surrealists, it probably started out like that. Blocking serotonin receptors modulates the release of all kinds of neurotransmitters in the CNS, including dopamine, norepinephrine, glutamate, GABA, and acetylcholine. In general, though, just remember that the atypical antipsychotic drugs share the property of weak D2 receptor antagonism and more potent 5-HT2A receptor blockade. The primary indication for antipsychotic drugs is schizophrenia. For most patients with schizophrenia, both first and second-generation agents are effective in treating the positive symptoms of the disease, including hallucinations, delusions, and disorganized thought or behavior. However, it's the second-generation antipsychotics that are probably more effective in treating the negative symptoms of the disease, which include apathy, flat affect, and a lack of energy. At Sketchy, we depict the positive and negative symptoms of schizophrenia as positive and negative voices being whispered into patients' ears. So, akin to the two outrageous mustaches radiating from Dalí's face, Second-generation antipsychotics are effective in treating both the positive and negative symptoms of the disease. Plus, Dali has been quoted as saying, "Each morning when I awake, I experience again a supreme pleasure, that of being Salvador Dali." No flat affect there. Alright, while schizophrenia is still the primary indication for antipsychotic agents, in the last decade or so, the use of second-generation antipsychotics has extended to multiple other conditions, including depression, bipolar disorder, and Tourette's, just to name a few. At Sketchy, whenever we talk about the treatment of depression, we'll include a symbol like this one on the wine bottle. The sad mask to remind you of the negative symptoms associated with major depressive disorder, and the happy mask to emphasize the goal of treatment, which is the remission of all symptoms. Several of the second-generation antipsychotics have been approved in the adjunctive treatment of depression, so as Man Ray over here struggles with that bottle of Chateau Tyramine Chardonnay, think of treatment-resistant depression, which is when depressive episodes do not respond satisfactorily to initial trials of antidepressant monotherapy. Oh, that's better. I thought one of those paintings looked a little bit misaligned. It turns out that second-generation antipsychotics have also been shown to be efficacious at further reducing OCD symptoms in some patients when added to their SSRI. That painting, though, where have I seen that before? That's right! This is Jean-Francois Millet's painting, The Angelus. When Dali was young, this painting captivated him. All those layers of hidden meaning, he was troubled by it, obsessed, if you will. And he incorporated it into many of his most famous works. Remember, with OCD, SSRIs come first, so check out our SSRI sitcom for more info, and check out Dali's archaeological reminiscence of Millet's Angelus for a creepy reinterpretation of this classic painting. The second-generation antipsychotic risperidone has been used to manage the motor tics associated with Tourette syndrome, though clinical practice has shifted toward the use of other dopamine depleters and alpha-2 blockers. Nevertheless, we've included our recurring symbol for this childhood neurological disorder. Just think of the sporadic motor tics of this Tourette marionette. Although the efficacy of second-generation antipsychotics is primarily driven by that D2 receptor blockade, it turns out that these agents exert blocking actions at numerous other receptors, leading to a wide range of adverse effects. For instance, all second-generation agents are H1 histamine receptor antagonists and thus have potential to cause drowsiness. At Sketchy, histamine is symbolized by an allergy-inducing bee. Antihistamines, therefore, are depicted as a bee swatter, like the one wielded by this gallery patron over here. You know, Dali was one of the most cutting-edge avant-garde artists of his time, but he was also greatly influenced by classical artists such as Raphael, Vermeer, Velázquez. I mean, just look at those bees! So real! Sedation is most prominent with clozapine and quetiapine, and patients should be warned about drowsiness with the first few doses of treatment. Also, just like with those first-generation antipsychotics, second-generation agents can cause orthostatic hypotension, likely due to their blockade of alpha-adrenergic receptors. Our recurring symbol for alpha-1 antagonism is an extinguished alpha candle, like this one above those unsettlingly lifelike histamine bees. Orthostatic hypotension is often accompanied by tachycardia, both of which are common in the first few days of treatment, or when the dose is increased. In some cases, it may even be severe enough to warrant a change in medication. Antimuscarinic activity also occurs with several of the second-generation antipsychotics. Antimuscarinic toxicity results from the inhibition of central and peripheral muscarinic receptors, kind of like how atropine works. And if you look closely behind that curiously positioned wardrobe, you can see a painting of some kind of tea party. Wait a minute, that's our Atropine in Wonderland sketch. Clozapine has the strongest affinity for muscarinic receptors among the second-generation agents, and that's why the atropine painting is positioned behind this hastily installed wardrobe. Specifically this clozapine closet, if you will. The symptoms mostly reported are dry mouth, constipation, and even some blurred vision or urinary retention. However, with the rest of the second-generation antipsychotics, these symptoms are mild or absent, so that's why the painting is only partially in view. Antimuscarinic effects can be quite prominent with the first-generation agents, so check out Van Gogh's gallery for more info. Hold on a second though, because it's time to reveal Dali's masterpiece, his pièce de résistance, his weird, sleepy face painting. You know the one. You know what? It kinda embodies a few of the side effects I just mentioned, actually, including that antihistamine sedation, as well as that anti-alpha orthostatic hypotension. I mean, just look at those little crutch things propping him up, I guess. That guy is out. I think it's a guy? Not only that, it also illustrates the significant metabolic side effects associated with second-generation antipsychotics, one of the main features that distinguishes these agents from first-generation drugs. See that plump rotundity getting propped up there? Weight gain is associated with many of the second-generation antipsychotics. The mechanism by which this occurs is not entirely clear, though there is evidence for both increased appetite and altered metabolic control with these drugs. In fact, weight gain is just one component of a metabolic syndrome associated with second-generation agents. Other related effects include dyslipidemia, hence the surreal melting stick of butter getting propped up there, and diabetes, as depicted by a recurring sketchy symbol for hyperglycemia, candy. Lots and lots of candy. A landscape filled with candy. But what does it mean, Salvador? Although no second-generation antipsychotic is entirely free of these metabolic effects, there are major differences in their prevalence among medications. Clozapine and olanzapine carry a significantly higher risk. Ziprasidone carries the lowest risk of these metabolic effects. Just think of that chic, thin black dress back there. Looking pretty good. Alright, it's time to reveal the final painting. Now, I know you were wondering what was behind this kooky avant-garde armoire. Well, this is the clozapine closet, of course, and inside we've illustrated some of the important side effects of clozapine that you should immediately recognize on the exam. Clozapine can cause neutropenia and a potentially life-threatening agranulocytosis. Agranulocytosis specifically is illustrated here by those classic melting sand timers. Just think of those falling granules, meant to evoke an image of the falling levels of granulocytes. Absolute neutrophil count must be routinely monitored in clozapine patients. Low rates of neutropenia have also been reported with other second-generation agents as well, so if your ANC is less than 1500, better think about switching agents. We're not done yet, though. Clozapine is also associated with a potentially fatal myocarditis and cardiomyopathy, most often in the first few months of treatment. Hence, that sad-looking little heart sitting there in that surreal landscape. Also, you see that alarm clock highlighted by those sketchy seizure lines? Clozapine is also known to lower the seizure threshold. In fact, seizures have been reported with several of the second-generation agents, though clozapine confers the highest risk. Consequently, all of these drugs carry a standard warning about seizure risk. Alright, the defining difference between second-generation antipsychotics and their first-generation predecessors is a reduced incidence of extrapyramidal symptoms. Recall that these symptoms arise due to D2 dopamine blockade in the nigrostriatal tract, which is normally involved in the control of muscle movement. Symptoms similar to those seen in Parkinson's disease result, including akathisia, rigidity, bradykinesia, tremor, and acute dystonic reactions. At Sketchy, that pyramid-shaped newspaper hat emblazoned with the word extra is our recurring symbol for extrapyramidal symptoms. Because these symptoms are reduced with second-generation agents, we've made this uncivilized newspaper hat-wearing patron creating a disturbance and being politely asked to leave the gallery. Psh, Philistine. Remember, though, that all antipsychotics, even second-generation agents, can cause extrapyramidal symptoms. Of the second-generation antipsychotics, risperidone is the one associated with the highest risk, hence the whispering gentleman here provoking the initial outburst. Also, you see that milk flying out of his nose? Secretion of prolactin from the anterior pituitary is regulated by the inhibitory effects of hypothalamic dopamine. Because antipsychotic drugs block D2 receptor activation, there is a loss of normal tonic inhibition of prolactin release, leading to hyperprolactinemia. Again, this is much more of a problem with first-generation antipsychotics because second-generation agents have much less effect on D2 receptors. Nevertheless, it turns out that risperidone is added again and is highly associated with elevated prolactin levels. Just get him out of here. That's enough! This elevation in prolactin can lead to galactorrhea and menstrual disturbances in women as well as sexual dysfunction and gynecomastia in men. Also, you see that bucket of chicken he's holding? Now More Spicy, or NMS, should remind you of neuroleptic malignant syndrome. NMS is most often seen with the high-potency first-generation antipsychotics, and that's why he's taking it with him as he exits the gallery. However, every class of neuroleptic drug has been implicated, even the second-generation agents. NMS is a life-threatening neurologic emergency associated with the use of dopamine-blocking agents and characterized by a distinctive clinical syndrome. which includes mental status changes, rigidity, autonomic instability, and fever, hence that spicy, fiery chicken. Not only that, at Sketchy, we use a bite out of a chicken leg to remind you of rhabdomyolysis. The muscle rigidity associated with NMS can lead to profound elevations in serum creatinine kinase. And lastly, several second-generation antipsychotics are known to cause prolongation of the QT interval. This is hypothesized to occur via direct inhibition of cardiac potassium channels, which slows ventricular repolarization. QT prolongation increases the risk of torsade de pointes and potentially lethal arrhythmias, hence the twisting points decorating these streamers. I think I see Louis Buñuel slicing out the other eye of that smiley face cake, so let's hurry up and get to the after party. I just want to quickly sum up by highlighting a few of the key differences between first-generation and second-generation antipsychotics. Quetiapine, olanzapine, risperidone, aripiprazole, Zipper, Closet. Though they share the property of D2 receptor antagonism with first-generation agents, second-generation drugs also exert potent 5-HT2A receptor blockade, so remember that smiley serotonin cake. Also, first-generation agents are mostly effective in treating only the positive symptoms of schizophrenia, while the second-generation antipsychotics treat both the positive and negative symptoms of the disease, hence the positive and negative whispering voices accentuating Dali's flamboyant mustache. Second-generation agents are also associated with a metabolic syndrome that includes weight gain, dyslipidemia, and diabetes, and bizarre little crutches to prop up the excess girth. And inside that clozapine closet, feast your eyes on some avant-garde agranulocytosis, myocarditis, and lowered seizure threshold. Lastly, the defining characteristic of second-generation antipsychotics is the reduced risk of extrapyramidal symptoms, hyperprolactinemia, and NMS. Now, let's hurry up and get over to the reception. We're gonna miss it. You know he doesn't last long when he dons that deep sea diver suit.